Hi friends, today we will be discussing a very common problem that many households face, especially where there are children. A lot of children complain to their parents that they are not able to breathe from their nose, and the parents take it lightly. And then subsequently, parents start noticing that the child is snoring in the night, and over time the child is breathing from the mouth. These children have a very disturbed pattern of sleep. They are also not able to sleep. Parents are also not able to sleep. Eventually, they start giving the children medications. They think that these problems will get solved with topical medications or syrups, and meet many doctors, meet pediatricians, and then also meet ENT doctors. Main issues that these children face when they have snoring is something due to a gland enlargement which happens at the back of the nose. Most of the times, these children have an enlarged adenoid tissue, which is basically a simple lymphatic glandular tissue which will enlarge due to repeated infections. Along with this, the children also will have something called as an enlarged tonsil at the back of the throat. When the air passage from the nose aspect is obstructed due to this gland, the child automatically turns towards breathing from the mouth. When this mouth breathing starts, the mouth is always open in the night, the child is snoring heavily, there's always a disturbed pattern of sleep, there is a neck extension pattern which the parents will observe and also come and inform the doctors, and also the child will have repeated infections due to the obstruction. These problems can be solved easily and in a very effective way by getting these two glands out of the way. The adenoids and tonsils are useful and act as first barrier of defense for any form of infections in kids. Many of the parents are under the impression that these glands are required, and also they are informed that these glands will shrink in size as a child grows. A lot of them don't understand that when the glands have reached their maximum size in the child and causing airway obstruction, there is no regression or reversal of the size. In fact, it puts the child under great amount of stress and causes sleep apnea. Ideally, it is better that the child visits the ENT surgeon, gets a complete evaluation, and gets these glands removed which have no further purpose of function and cause more of obstructive symptoms. The other things that the parents also will encounter, that the child is hearing lesser. This is only as a collateral issue that the child develops middle ear fluid collection behind the eardrum. We call it as middle ear effusions, which also is a consequence of these enlarged adenoid tissues. It is always ideal to consult your ENT and get this problem resolved when you see these issues happening in your kids. Thank you.